Good morning, everyone, and welcome to this webinar from a very warm, sunny Dublin. My name is Fiona Kyle. I'm the CEO of Mental Health Forum, and I'm really delighted to welcome each and every one of you here from all over the country, and I believe also from further afield in Europe and beyond. For those who are not familiar, Mental Health Reform, we are Ireland's leading national coalition on mental health. Our vision is of an Ireland with accessible, effective and inclusive mental health services and supports for everyone. As a coalition, we bring together over 80 member organisations and thousands of individual supporters, providing a unified and powerful voice on mental health issues. Our strength lies in our collective commitment that our members and our supporters have in driving progressive reform of mental health supports throughout the country. Coalition Conversations, the webinar series, this provides a platform for us as a sector to explore new developments and innovations in mental health and facilitate knowledge sharing within the mental health sector and indeed beyond. And this first webinar is in a series, first webinar will focus on the topic of social prescribing. Now, this is an area that has had a huge spotlight on it, I believe, over the last number of years, and it has the potential to advance the recovery agenda in mental health and to assist people to access the wealth of supports available through the community and voluntary mental health sector. Now, the HSE, who we'll hear from a little bit later, is currently expanding its social prescribing across Ireland to ensure that the service is available in every county by the end of 2023. This webinar, very timely webinar, will explore the impacts and barriers to implementation of social prescribing in Ireland, particularly as it relates to the community and voluntary mental health sector. And it's very much coming from a recovery-focused perspective. As with all of our events, we would really encourage you to share your thoughts as we're going through the various presentations. And if you are sharing them, please use the hashtag Coalition Conversations. If we move on to the next slide, please. I'm just going to bring you very briefly through the agenda. Unfortunately, one of our speakers did have to drop out this morning, but we still have a really rich, diverse agenda ahead of us this morning. So firstly, we're going to hear from Susanna Weedle, who is our Policy and Advocacy Coordinator here in Mental Health Forum, and she'll be presenting on our new briefing paper on social prescribing and the voluntary and community mental health sector. This document, which is available online, offers recommendations on how social prescribing can be prioritised and advanced, as well as the perspectives of some of the community and voluntary mental health sector on social prescribing. After that, we're going to hear from Orla Walsh, who will discuss how social prescribing has evolved in Ireland and the HSE's plans to expand the programme in the future. And then our third speaker is Sarah Sheridan, who will share her experiences of working as a social prescribing link worker with Flourish Social Prescribing Service in Castlebar, County Mayo. Just if we move on to the next slide, as always, if there are anything in today's webinar that people may find distressing, please be aware that there is a lot of support out there. You can visit our own webpage, mentalhealthforum.ie, where you will be able to find a full list of our members and the supports that they offer. You will also be able to link into the HSE dedicated mental health webpage, which outlines a full range of supports and services available across the country. Of course, there is also the 50808 text to support service. If you text hello, it's a free and 24 hours, 7 days a week services that offer support. Yeah, so without further ado, I'm going to move on to Susanna, who is our first speaker today. And just briefly about Susanna, she's with us here in Mental Health Reform since April last year. She's previously worked in crisis management, supporting people through a range of trauma scenarios internationally. And she's also worked as an intellectual disability nurse across a variety of services with people with intellectual disabilities, many of whom also experience mental health difficulties. So we're very fortunate to have Susanna here with us on our team. So over to you, Susanna, if you want to take us through our new document.
Thanks so much, Fiona. So as Fiona said, my name is Susanna. I'm the Policy and Advocacy Coordinator here at Mental Health Reform. And I just wanted to say thank you all so much for joining us here today. I'm going to introduce you very briefly to what social prescribing is, and I'll let the experts in the area delve into it in a bit more depth afterwards. I'm also going to talk you through our briefing paper on social prescribing in the voluntary and community mental health sector, which is now live and available on our website at www.mentalhealthreform.ie/social-prescribing. And all registrants will be emailed the briefing paper after the webinar. And I just want to say a huge thank you to Stephen in our comms team for working on finalising the design and website update, and to Niamh, who in our comms team as well, who's working away there in the background to make sure this webinar runs smoothly. So first of all, what is social prescribing? So many people here today may have never heard of what social prescribing is, but hopefully you'll have a better sense of it after this webinar. So first of all, social prescribing is a non-clinical support. It's a community-based support. It's a service where someone can meet with a person called a social prescribing link worker, one-to-one, to explore what groups or activities in their community they'd like to get involved in. And we're very fortunate to be joined today by a link worker, Sarah, who's based in Mayo. And she'll tell you a little bit more later about what it looks like to access a social prescribing service. The social prescribing link workers come from a variety of backgrounds, including social, community, health, or related fields. Social prescribing is a short-term intervention, but it aims to link people with more long-term community supports. And a person may choose to access social prescribing for a variety of reasons, like loneliness or social isolation. They may have chronic health issues and need support with how to move back into employment after a period of absence. They may have recently moved to the area and need help integrating into their new locality, or they may have a mental health difficulty and feel ready to independently engage in a community group or activity, but need help figuring out what's available and what they need. So the type of community support that the person is referred to will depend on the needs and preferences of the person and what's available in the locality. So the link workers would research the community supports thoroughly before referring somebody in. In some cases, they may have met with the community supports in their locality in advance and could also attend an initial meeting with the person if the person felt they needed that support. So some examples of the types of supports people can be linked in with include local exercise groups, educational classes, peer support groups, or other social activities that are linked with their interests. And to bring it back to our wonderful membership, there are a huge amount of programs, including things like recovery colleges, peer support groups, educational programs, counselling, etc., offered by our membership that would link very well with social prescribing. In terms of the process and how to get into social prescribing, there are many ways to be referred. The person can be referred in through their GP, through another healthcare provider, and I think this is what is really lovely about social prescribing, the person can self-refer. All the contact details for the social prescribing services are available online on what's called the All Ireland Social Prescribing Service website. And it's www.allirelandsocialprescribing.ie, and you'll be hearing a bit more about that maybe later. And finally, just to give you a sneak peek, I suppose, at our briefing paper. So we wanted to create a resource to inform people about social prescribing, and we also wanted to get a sense of the interplay between social prescribing and the voluntary community mental health sector. So as part of the development of the briefing paper, we invited our member organisations to participate in focus groups. We spoke to a social prescribing service directly and also to colleagues in the HSC about the implementation of social prescribing in Ireland. And we're very grateful to Orla Walsh, who's going to speak to us a bit more about the rollout of social prescribing in Ireland today, a bit later. So the briefing paper talks you through what social prescribing is, what the process looks like, and where it's available. It also discusses recommendations on how the social prescribing services and the services offered by the voluntary and community mental health sector can collaborate and complement one another. It also talks through some case studies on social prescribing in the area of mental health, and it provides links to resources for those looking to find out more about social prescribing. We hope that it'll serve as a tool to help spread information about social prescribing. And as I said, it's available on our website now today, so it's hot off the press. So that's all from me. Thank you very much. I'll hand back over now to Fiona to introduce our next speaker.
Thank you so much, Susanna. And I should have added as well that there is a Q&A function. It should be at the bottom of your screen. We will have a Q&A section at the end of the presentation. So if you have any questions, please do add them into the Q&A, and we will get to them during that session at the end. Yeah, so we'll move on now to our next speaker. So Orla, if you want to unmute and come on screen, you're very welcome. Thank you for joining us. So Orla is a project manager working in mental health and wellbeing program in the HSE. And Orla, you have a background in research, policy and health promotion in the areas of childhood obesity, food poverty, cancer screening, mental health promotion and social prescribing. And I know that you're really centrally involved in supporting and mainstreaming the integration of social prescribing within the HSE, and we're really eager to learn more about your work. So over to you, Orla.
Great, thanks a million, Fiona, and thanks for the introduction. So I'm just going to try and share my screen. Okay, is this visible, Susanna, Fiona?
That's perfect, Orla.
Yeah, great. Thanks a million. So thanks to everybody for joining today, and thanks for the lovely introduction, Fiona. And delighted to be here to give an overview, I suppose, from a national perspective in the HSE on some of the strategic developments regarding social prescribing in Ireland and within the health service. A lot has happened in a very short space of time. So, and there's an interesting story in the journey as well, which I'd like to share. So yeah, the focus of my presentation is going to be how social prescribing has evolved in Ireland and the health service, an overview of our HSE social prescribing framework, and social prescribing and mental health, which of course is the focus of our conversation today, a little bit about evaluation and looking to the future and next steps. So yeah, the journey, it's been an interesting one. And I suppose to kind of start from the start, social prescribing very much has been led and developed and grown in Ireland by the community and voluntary sector. The very first social prescribing services that were set up, it was actually in Mayo, and it's great to have Sarah here today, even though Sarah's been in post around 12 months, but there's huge learning from the Flourish project in Mayo, where Sarah works. They were the pioneers, if you like, of social prescribing, being the very first service that was set up in 2012, followed closely by Donegal. And I suppose the Mayo and the Donegal services really provided a blueprint really for how social prescribing has evolved in Ireland and in the health service. Typically, the link work being based in a community and voluntary organisation like a family resource centre or a local development company like a partnership company, and receiving referrals from a wide range of health professionals and community-based organisations. Just to kind of touch on some of these milestones along the way in terms of how we got from 2012 to where we are today, with close to 50 social prescribing services now funded by the HSE. In 2017, that was quite an important milestone whereby the Department of Health provided mainstream funding via the Healthy Ireland Fund for 6 social prescribing services. So this was the first time that the Department of Health or a state agency had kind of I suppose, got their shoulder behind social prescribing in a kind of strategic way by funding a number of services via the Healthy Ireland Fund. A shout out 2018 to my colleagues in the All Ireland Social Prescribing Network, which is an all Ireland group of people from a wide range of sectors, from health and beyond health, community and voluntary sector. We've got social prescribing link workers on the network and academics. And we're essentially a group of people who are passionate about social prescribing, see the value in it in terms of how it can improve health and well-being of people across the country, reduce isolation and loneliness, and who are really focused on mainstreaming social prescribing. So that the All Ireland Network held a number of conferences over the years, which were quite pivotal in terms of enabling the growth of social prescribing, because a number of them would have been kind of, I suppose, attended by commissioners, policymakers, funders. And at those conferences, there were often really powerful testimonials from service users and members of the public who had been beneficiaries of social prescribing, and they were hugely impactful in terms of, I think, paving the way for social prescribing to really take off in Ireland. In 2020, the first time social prescribing was referenced in a national policy document in Sharing the Vision. There's an action related to social prescribing in Sharing the Vision, which is really important, because we had the bottom up and of course the policy piece is the top down, which is essential also. And then 2021, the launch of the HSE social prescribing framework, which I'm going to talk about shortly. And I suppose that the start of mainstreaming and integrating social prescribing within the HSE in partnership with the community and voluntary sector. So just a little bit of background, and Susanna has framed very well what social prescribing is, and of course Sarah will elaborate on this a bit further. 20% of patients attend their GP for what is primarily a social problem. We've heard GPs talk really movingly actually about, I suppose, how challenging it can be in their role when they know the person who's sitting in front of them is attending for or coming to their practice for an issue that might be a social issue in origin. It could be related to grief, it could be related to bereavement, it could be housing, it could be debt, those social determinants which we're all so familiar with. And one GP, Derek O'Keirda, who's based in a deprived area of South Dublin in Jobstown, talks about kind of being afraid to open that Pandora's box when you're limited in your capacity to be able to address these wider social issues. But social prescribing can expand the range of non-medical options available to healthcare professionals when a person has needs that are related to socioeconomic and psychosocial issues. Obviously, social prescribing has the ability to be able to address those wider determinants of health. I think sometimes I really kind of wanted to get the piece across today that social prescribing is obviously about linking people with, physical activity. It could be walking groups. It could be things like arts and creativity based interventions at men's sheds. They're all really important referral routes for social prescribing, but it also has the ability to be able to address those wider social issues. I've heard amazing testimonials from social prescribing link workers across the country about how they've supported people to re-engage with the workforce in terms of helping them with, interview skills and CV preparation workshops, helping people navigate housing application processes, and directing people to money advice and budgeting services. So it really has the potential to be able to address those wider social issues. It takes an assets-based approach, and it utilises and builds on the local community assets that are available in an area. So it might look slightly different in each community, depending on the groups and the offerings that are available locally. Sarah is going to elaborate on this an awful lot more, but just to say that social prescribing focuses on what matters to the person rather than what is the matter with the person. And I think that's a really powerful reframe. The link worker works in collaboration with the person over a period of time using a personalised coaching and co-production work, very similar to the type of, I suppose, approach that would be typical in recovery education services. People are fascinated by the background and the training of the link worker role. Just to mention, we actually have a job specification in our HSE social prescribing framework, which is available online. But really, we have amazing link workers across the country who come from a very broad range of backgrounds. Some have been nurses in their former lives, some have been OTs, some are community development workers. It's really about the link workers' personal skills, their ability to listen, connect, communicate, and empathize with the person who they are working with in a person-centered, non-judgmental way. Susanna has already alluded to this. I suppose the key question many of you will have is, how do I find out about my local service? How do I access it? So the best route is via this HSE funded website, which is the website of the All Ireland Social Prescribing Network, which I referenced earlier, allirelandsocialprescribing.ie. I'd encourage you to go to the members map on that website, and you'll be able to zoom in and click in your local area and find the details of your local service and contact them directly if you want to organise a referral on behalf of yourself or somebody else. This map is going to change in the next few months. Galway was a bit of a black spot there, but we have 2 new services that are going to be up and running by the end of the year in Galway. So that's great. So HSE Social Prescribing Framework, this is a document which we launched in 2021. And it really sets out a common approach for the delivery of social prescribing within the HSE. It was designed to support those involved in the delivery of HSE funded social prescribing services. But I think for anybody who's on this webinar today who mightn't know an awful lot about social prescribing or who wants to learn more, I think you'll get a lot from the document. It kind of goes through, what social prescribing is, the referral pathway, and answers many questions that people might have actually about the intervention. It's not intended to be a prescriptive document because, as I mentioned before, social prescribing is built on local assets which are unique to each community. So variation in terms of what social prescribing looks like is to be expected. However, we have learned an awful lot over the last 10 years in Ireland in terms of what good social prescribing looks like, and these learnings are embedded in the framework document. So implementation in the HSE, I suppose the HSE would have, over the years, over the last 10 years, would have provided some kind of seed funding and to some of the initiatives that would have started back in 2012, 2013, 2014. But from 2021 onwards, the HSE has been focused on mainstreaming and integrating social prescribing across the organisation. This started in 2021 with 19 sites. Some of you may have heard of the term the Sláinte Care Healthy Communities Initiative. So this is an initiative funded by the Department of Health, being led by our own department, HSE Health and Wellbeing. It's focused initially on 19 areas of disadvantage across Ireland, with hopes for expansion beyond those 19 sites. And in each of these 19 areas, social prescribing is one of a suite of health and wellbeing interventions being offered across these areas. Some of you also may be familiar with the former Sláinte Care Integration Fund, which would have been launched by the Department of Health back in 2019, I believe. And 12 social prescribing services would have been funded via that fund, and those services have already been mainstreamed within the HSE. Similarly, another 9 services would have been funded via the Healthy Ireland Fund year on year, but these services have also been mainstreamed. So we're now in a situation by the end of this year where we'll have close to 50 sites and close to a service in each county. Just to mention as well, the Community Connectors pilot. So Community Connectors are very similar to social prescribing link workers. This is a pilot that has been rolled out, 1 per CHO, and Community Connectors work closely with the integrated care teams for older persons in the HSE. And these Community Connectors would receive referrals from those teams for older people in their areas to ensure, I suppose, that they stay well in their communities rather than being, having to go to acute hospital settings. So it's about keeping people well in their communities. So we're watching with interest how the Community Connectors roles evolve in the HSE. So social prescribing is delivered at local level by community and voluntary organisations, as I mentioned, typically family resource centres and partnership companies through grant aid agreements with the HSE. Social prescribing link workers are recruited, employed and hosted by these community and voluntary our community and voluntary partners. And the hope over time is that there will be 1 social prescribing link worker per community healthcare network. So for those of you on the call who may not be familiar with community healthcare networks, there's 96 of them now. They're how our health services are, I suppose, delivered at local level. There'd be 4 to 6 primary care teams per community healthcare network, and each community healthcare network, or CHN, would serve a population of around 50,000 people. So social prescribing really has the potential to broaden the range of support that health professionals can offer to our service users, and can be integrated within a wide range of health services and programs, such as those listed on the screen here. And we're working with each of these arms of the organisation to enable referral pathways in and out of social prescribing, to support our service users in terms of reducing social isolation and improving health and well-being. Social prescribing and mental health. I pulled out some recent data from across our 19 Sláinte Care Health Community sites, which showed that mental health is the second most common reason for referral after social isolation. And I'm going to elaborate on some of those slides shortly. Social prescribing is widely used to support people with mental health challenges. And from some of the research that we've seen from both Ireland and the UK, outcomes can include enhanced self-esteem, reduced low mood, as well as social benefits. We had a very fruitful conversation organised by ourselves in the HSC and Mental Health Ireland and shared by Donal O'Keefe from the Arches Recovery College in South Dublin there in March, a virtual conversation between recovery education services and social prescribing link workers, because I suppose we understand that there's so much mutual objectives and between recovery education and social prescribing. And there's already some kernels of really good practice that are happening across the country of partnership working between recovery education services and social prescribing services. And we wanted to provide a platform to kind of discuss this in greater detail, to shine a light on some of the good work that was happening, and I suppose to explore opportunities for further engagement. Some of the takeaway messages, I suppose, from that session for me was that the timing of a referral for a person who might have lived experience of mental health challenges is important, and that in order for a person really to reap the most benefits from social prescribing, they'd ideally be in a place where they're ready to engage and participate with local community groups and supports in these areas. The role of a peer support worker can be very beneficial also, and I think it would be great to explore how the peer support workers working in mental health and social prescribing link workers could work together to support participants to engage with social prescribing services. And I think Sarah is going to elaborate on this a little bit more in her presentation. I'm going to whiz through some of these slides just in terms of kind of data. This is from 19 of our HSE funded social prescribing services. I've already touched on this in terms of reasons for referral. So social isolation would be top of the charts there at 55%, followed by mental health, then social issues, long-term health conditions. In terms of the other, physical activity, bereavement, housing support, and COVID were included in the other category. Source of referral, 21% self-referral. Then other, which basically would include referrals from health and social care professionals like dietitians, addiction support services, physiotherapists, counsellors, disability services. We see mental health nurses at 6%, which is great, and OTs at 7%. Public health nurses and practice nurses are also referring to the service, which is wonderful. Just in terms of an overview of gender across age ranges, overall 63% of our participants would be women and 37% would be men. For women, we see a kind of an incremental increase with age, with the highest rates of participation there in the over 75s. For men, relatively equal levels of participation for those aged 45 to 54, 55 to 64, and 75 plus. So very interesting kind of trends there. And employment status, 33% of our participants would be retired, 23% unemployed, 16% unable to work, and 11% employed, and carers are coming in at 2% there. So just in terms of evaluation, we're really keen to build an evidence base to be able to demonstrate impact and outcomes of social prescribing. It's quite a complex intervention, and it can be quite difficult to evaluate. There's been a number of systematic reviews that have been done on social prescribing in Ireland and the UK, and the kind of takeaway or conclusion really from these systematic reviews is that the randomized control trials that are typically done in this space all are looking at different things. So we're not comparing like with like. So it's very difficult to get a clear picture around what works. So we're really, I suppose, dedicated in the HSC in terms of developing an Irish evidence base to demonstrate impact and outcomes of social prescribing on our participants. I have to say, in terms of qualitative data, I've been in the room when service users and participants of social prescribing have kind of talked about the impact that their experience of social prescribing has had on their lives and how transformative it has been. And that's when the scales really fall from people's eyes. You know, it's so impactful to hear directly from service users about their experience. We tried really hard to get a service user on board for today, but it just didn't work out. But we have some fabulous testimonials actually on the Ireland Social Prescribing.ie website under resources of service users and their experience of engaging social prescribing. We're working hard behind the scenes in the HSE in terms of advancing to procure a digital software platform to support the collection of output and outcome data to support, to demonstrate the impact of social prescribing. And this is something we're making progress on. So some remaining challenges, and I'm coming to a close here shortly. Evaluation and data collection, which I've already spoken about. We often hear, I suppose, sometimes from our colleagues across the system that, you know, great support and appreciate what social prescribing is, but sure, haven't we been doing this for years? A kind of a curious skepticism, we call it. I think it's important to illustrate that social prescribing is much more than a signposting service. So the link worker might work with an individual anything up to, excuse me, 6 to 8 sessions. So it is much more than, pardon me, it is much more than a signposting service. It's about supportive access. We have a bit of work to do in terms of engaging with GPs across the country. We have some amazing GP advocates and we need to build on that support for sure. And very conscious that the policy support for social prescribing must be accompanied by adequate funding for the community and voluntary sector. We've learned a lot from our colleagues in the UK, where social prescribing has been up and running for, I suppose, a few years longer than it has been here in Ireland. And I suppose there's some examples from the UK where the community and voluntary sector is kind of struggling to keep up with the demand being generated by social prescribing. So we don't want that to happen in Ireland. So this is something we're very, very conscious of in the HSE and beyond. So looking to the future, we've established a national advisory group within the HSE for social prescribing, which includes service users, social prescribing link workers, managers of community and voluntary organisations who are hosting social prescribing services, and HSE stakeholders also. And this advisory group has been set up to support the good quality implementation of social prescribing in the HSE. I've mentioned the integrated care programme for older persons and those community connector roles, which is a pilot. So we'll be watching that with interest to see how that work progresses. Careful attention to learning and evaluation. And in fact, in the HSE, we're just setting up a learning network for social prescribing link workers and those involved in the HSE who are indirectly or directly supporting social prescribing. It's a community of practice based on case-based learning, where we'll meet once a month initially for a year, and we'll see how it goes, where we present maybe challenging cases and learn from each other in a safe space and co-produce guidance based on our this consensus-based approach. So this is called Project ECHO, and it's been up and running in Northern Ireland for quite some time. So we're introducing it in the HSE for social prescribing, which is an exciting development. Learning from new developments. It's going to be so interesting to see how social prescribing evolves in Ireland over the next few years. We have one social prescribing service in James's Hospital, in an acute hospital, a very unique, I suppose, setting, which I suppose could be hugely impactful. So we're watching how things developed in James's very closely, and how maybe that model could be translated into other acute hospital settings across the country. There is some work happening across the country in relation to social prescribing for families and young people. I should say that HSE funded services are for adults over the age of 18, but interesting to see how social prescribing for families and young people may evolve over time. That we are partnering with Creative Ireland, who have been hugely supportive around how social prescribing can be a bridge, I suppose, to help members of the public access arts and creativity-based endeavours in their community. So interested to see how this evolves, and obviously the ongoing expansion of social prescribing in the HSE. Just some useful resources to link to there, and I'm sure these slides will be shared after the webinar today, and I'd encourage you to have a look at these websites and these documents to learn more. So that's it from me. Thank you for your attention.
Thank you so much, Orla. I think there's so much to digest there, and I was really struck by, you know, the whole kind of building on those local assets, and also, you know, I'm very aware of the big changes that are happening in the HSE at the moment as we move towards the implementation of Sláinte Care. And Sláinte Care is very much about, you know, integrated care and being person-centered, you know, right care, right place, right time. And I think it's probably fair to say that, you know, in our health service at the moment, that people navigate the system themselves more so than the system helps them navigate the services that they need. So it's really great to see something that actually has at its heart person-centered integrated care. So yeah, really thank you for that, and looking forward to the questions and answers afterwards. So now we're going to go with the beauty of Zoom and technology to the west of the country, to Castlebar, which I believe the sun is shining today as well. So Sarah Sheridan, as I said, is the social prescribing link worker in Flourish Social Prescribing Service at the Family Centre there in Castlebar. And Sarah joined the centre and the team in January 2022, as Orla noted. And Flourish is a social prescribing service connecting people with community groups, activities, organisations and statutory services to help them improve their health, well-being and social connectivity. After graduating with the BA in Applied Social Care, Sarah has worked with marginalised people in statutory and voluntary organisations for over 25 years. And in her life and in her career, I know you're really passionate about positive living and well-being and really helping people build their resilience. So I know that you're going to give us further insight on, you know, what this actually looks like on the ground. So Sarah, over to you.
Thanks so much, Fiona. And thank you so much for inviting me to represent Flourish here this morning. I'm really delighted. I hope from my presentation that you really get a sense of what social prescribing is all about, and I suppose the how it actually works. I'll explore some of the challenges maybe facing people who have mental health difficulties, and also look at maybe opportunities where voluntary and community sectors can link with their local social prescribing service and with whatever programs are available. Also, just to be very mindful of the referral pathway and the service and how it is open for all. So I really hope that I can bring the briefing document to life in this presentation, which I'll just share now. So I just check that's all good.
That's perfect, Sarah.
Great, thanks, girls. Okay, so yes, I am delighted to work at the Family Centre here in Castlebar with the Flourish Social Prescribing Service. I'll just give you an overview of our history. I won't go into too much detail. As Orla has mentioned, we are delighted to have been the first service in Mayo with our first social prescribing link worker, Maura Horkin, in the area. Over the years, there has been a number of evaluations and the service has developed and expanded rapidly, and we are delighted about that. With the funding from the Healthy Ireland communities, the Sláinte Care Healthy Communities, with Healthy Ireland funding and HSE funding, we are delighted to say that we have a service now that covers almost every part of Mayo. This is a flavour of, this is our staff team here at Castlebar, or in Mayo. I'm in Castlebar, and in East Mayo we now have a full-time service from 2023. So that is a fantastic development. And we have the service in North Mayo in Achill and Belmullet with our 2 project worker link workers there as well. So who is social prescribing for? So this is, we'd say, it is for anybody who is over the age of 18 years of age. People maybe who have experienced a change in life, a health issue, retirement, becoming a parent, bereavement, change of employment, new to the area, maybe a relationship change. People who feel maybe isolated or struggling to connect with other people, people who have long-term health conditions, people who may need support with their mental health, people who are frequent attendees to the GP or emergency departments and who would benefit from social supports, as Orla had explained there. What we offer here at Flourish is a confidential one-to-one service session. I'll talk through the process and how it actually works. We connect people with the activities, the events, the resources, whatever it is available in their local community. Often we would aim for supports that are free, that are accessible or low cost. And really connect people with what is happening in their community. The support and the motivation for the participant to attend these activities and groups, I suppose that is the key, that it isn't just information, it isn't just the signposting, it is that key of having support and hand-holding. And some people may need more of that than other people, but it is the crux of social prescribing. We have been very fortunate in Flourish that we have received additional funding, and we have actually provided what we call stepping stone or intermediate groups and programs. I'll speak a little bit about those later on. You'll see a flavour of them. But these groups are ideal for people who may struggle to take that step, maybe joining the generic groups in their communities. So there's a wide variety of those. We would notice if there was a gap in a particular area, and we would provide that support. And I suppose that gives people a very positive experience from their initial contact with us, the link workers, on a one-to-one basis, a positive experience in a group setting, and hopefully and ideally then that they move on to whatever other programs and groups are available, and we've been very successful with that. And then beyond that, that people develop broaden their wider circle, develop friendships and social supports that really enhance their health and their well-being. We have a mailing list where we would post different activities, different events, groups, different things that are happening in our area, and it's a fantastic resource. It's ever changing. It is hard to keep on top of it because so much happens, but it is amazing. Some people can miss what is happening, so that's very well received. And our Flourish follow-up, so that our contact with people after they've been involved with our service. I'll talk about that now as I go through the referral pathway. Sorry, I seem to have missed some slides. So I'll just recap on that. So this is the referral pathway. Excuse me about that now, sorry. So anybody who attends the Flourish service, they're known as participants for us. And as Orla had mentioned, those referrals can come from anybody in the healthcare profession, and also people themselves can just refer themselves to our service. We work with the person, as I've gone through there in the slide, and again it is the support that they transition into other supports in the community, and the key, the follow-up and the review, the follow-up to check that they've managed, they've got to where they wanted to go, and exploring what the outcomes, the positive outcomes were for them. So I've just gone through that one. So this is, I suppose I wanted to give you a sense of exactly what happens. So when we would receive, if we receive a referral, or if somebody is refers themselves, there's the two options. If we receive a referral, we would contact the person who's referred the participant. And I suppose through that conversation, just to see how best we can support the person to engage in our service. And that is key. And it's very important. The person, then we make contact with the participant, and we introduce ourselves and the service and explain, and you know, it's quite a simple concept, but I suppose it can be very, very daunting for somebody to take that step. So we are very mindful of that, and whatever way we can make it comfortable, that we can make it easy for people. That may mean a few phone calls before the person actually comes in for a one-to-one, or it may mean in some settings we might go and meet them in a comfortable setting, somewhere they're familiar with. And we would do that regularly. I suppose when the person comes in then to us, we invite them to share their story. We don't need to know details, but whatever they feel comfortable sharing, but it gives us an understanding of their context, of their needs and their strengths. And so in that process, you really, really get a sense of somebody's picture, of their jigsaw, as I call it, and just what it is that they are looking for. And sometimes people would say, I don't know what I want to do, or I don't know where to start. And I suppose we would take them through that. And again, it's hand holding, just to say, when we explore what it is that is important to them, a lot is unearthed. So it is a process of understanding. It's not an assessment. There's no strict criteria. You know, it is understanding where the person is at, and exploring their interests. And it is brilliant when you're sitting with somebody and they may come in and they may be uncertain, or they might never did anything like this before, or whatever it may be. And when you just explore what it is that gives them joy, what gives them a zing, what they really love, you know, and you can really see a change, and you can really see what is important. And that's where we build on then. I suppose you know, we're very in touch with what is happening in the area, and then we will get that information and we make a plan with the person. It's not that here's the information. So we make the plan with the person, and help them to get to the next step. And I might suggest something to someone and they might say, absolutely no way, I wouldn't be into that, which is brilliant. Or they might say, God, I never tried it. I'll try and do that. For us, whatever is needed to help the person, the participant, to get to where they want to go, we will do that. So we would often, you know, give them the motivation, maybe a check-in before a group started. We would often accompany a person to the activity and introduce them to the facilitators. We might visit a centre, we might introduce them to staff. All those things make it more manageable for people to get involved in whatever activities they'd like. Also, for some people, it may be a signposting. Some people come to our service and you know, they're in the space and they have the ability to take the information and off they go, and that's great too. I suppose from that also then we would have a follow-up and a check-in and to see how the person has got on. As this has been mentioned a few times, it is what matters to the person rather than what is the matter with them. It's not about what illness a person has, what life experience a person has. It is about what is important to them. And I like this one myself, what is strong rather than what is wrong. These are just a flavour of some of the groups and connections and links in that we link people with. I suppose, you know, it is about the connections, it's about, you know, getting active, the learning, volunteering, trying something new, and you know, the things like those things that help us cope, manage, whether it's out, fresh air, music, arts, creativity, mindfulness, meditation, and then maybe if it is support groups, recovery colleges, social activities, and also the health changing activities from HSE, the Quit Smoking, the Living Well, programs like that, all the men's shed. So it's so broad, and it's great. We would be very tuned into a lot of what is happening in each area. It's a very, very big part of our work that we do. So as I mentioned, our stepping stone programs. Over the years, it really has become apparent that there is a need, there is a gap, and there is a need for some people to have the opportunity to join some groups. And we've been very fortunate. We have a fantastic director here in our centre, and we've been very fortunate to receive additional funding. And this is just a flavour of the programmes that have run. We don't run these. Well, some of them do run throughout the year, but some of them have run and will run another term. So the likes of Mindful Mondays coming together, it was in face-to-face, but it actually moved online, and just coming together to do a mindfulness practice. Our creative cafes, they have been really well received. As Orla mentioned, the Creative Ireland funding has been invaluable, and we are delighted to launch tomorrow. Actually, we're launching a report, Creativity in the Community, an evaluation of the creative cafes, and that will be launched in ACL, another piece, great work. But those cafes basically were people coming together for 6 weeks and having a taster of a craft, art, music, and the impact that it had on their well-being and their lives. So we have arts and well-being, wellness with the flourish, our creative writing, at our John Hoban Music Circle. Now our John Hoban Music Circle, all these programs are amazing, but this is a fantastic program. It has run for 12 years. John Hoban is a local musician, and the circle really is people coming together. It's very, very open. It's very, very welcoming. It's very gentle support. People come together and they can come and sit back and listen to beautiful music, or they can come and participate. And we would have seen people over the years who would have come and would have found it really challenging to even come in and say their name. And they have evolved and developed, would often read a poem. Some of them have gone on to actually sing in public for the first time. Some of them have gone ahead to music lessons. And just the way John and his wife Isabella run that circle is truly amazing, and it is an invaluable support. And it is great, I suppose, for us here in Mayo now. You can see a lot of rambling houses coming back. And so some participants would move, you know, they go and they travel. So one night they could be somewhere and another night they could be somewhere else. So it really, really, the fundamentals started at the music circle, and we're very proud of it. Discover Your Interests was a 6-week initiative where people really delved deep into exactly what sort of things that they were interested in, and they got a taster and they got a flavour of some of the things that were locally and there, and also like a tour, even just a whistle-stop tour, and people would often say, oh, I didn't realise that's what they did there. So that's the type of thing that these groups do. Get active with Flourish, thrive and revive, get creative with Flourish, have a chat with Flourish, and give yourself the gift of a self-care day or morning. So I suppose when I was asked to do this webinar, I just really sat down and had to think about some of the challenges that face some of our participants, some of whom have mental health difficulties, and I suppose this is what we would, this is what we manage, and this is some of the people that we work with on a daily basis. And it is personal issues like low confidence, fear, anxiety, poor social skills. The external barriers in somebody's life, rural isolation, and for us, particularly here in Mayo, it is a massive county. Transport. It can be such a barrier when people actually haven't their own transport or access to transport, finances, and things like that. So the limited supports also and resources in a community. So somebody can come in and seek supports, but the groups may not exist in their community, and that can be a real challenge, and they may have to travel. Now we would really try and work with the person and get them, and it is, you know, we have a local link bus service, we have our ordinary bus service, but it is also, you know, it's something that we do really have to work with. The impact of COVID restrictions is still very prevalent for some people. While masks may be gone, the impact has been massive, and we would see that. Also, having nobody to accompany a person, so a participant may not have a social circle, they may not have friendships, they may not have family who are in a position or in a time to support them to go to an event. And I'll speak about an initiative that's here that we're involved in. And I suppose participants' readiness and willingness to engage. I suppose this is something we'd be very mindful of, and that's the importance of the timing. So for somebody who may be struggling, I suppose that it is the right time for them, that it's the right time that they themselves come to us themselves, or that they're referred, because it can actually be detrimental if somebody is referred and they're not in that place where they can engage in the process with us as link workers, or in to take the step to join in whatever activity they want. And so we just be very mindful of that. It's not that we would reject a referral, but I suppose it is that it is appropriate, and it is that it's the right timing for the participant. Some of the challenges for us as a service, as Orla mentioned there, you know, the curious skepticism. What is social prescribing? A big part of our work is the promotion of social prescribing and explaining the concept, and people are like, oh right, you know, is that what you do? You know, as we say, it is very simple, but for some people it can be very challenging to look up the paper or follow social media and say, oh, I'm going to go down on Tuesday night to that group. That is the difference. Assessing appropriate referrals for our service, as I just mentioned, you know, can be counterproductive. And I suppose in that, I had a referral from somebody and from the mental health services. And when I phoned them to link with them before I contacted the participant, they said to me they'd never met the participant, which really was it wasn't appropriate. So we went, you know, obviously they had gone back then to meet the person, and we have linked together to work with the person. But I suppose that's what's important, and that's what's great about doing webinars like this. People know, okay, that is what social prescribing is about, and that is how it works. And then, is it appropriate or is it not for the person or for someone who you work with? If somebody is unable to engage in the process, and I suppose, you know, we're trained, we're well supported to engage, to help people. We really go to every length to help people engage, but some people they may not engage in the process. I've mentioned this, the lack of suitable groups or supports available, particularly for people who might need additional support to engage. this is something that we would notice the lack of training or awareness by some groups to integrate new participants, and that is something. Some groups are run by volunteers, some people who mightn't be aware of the importance that it is full inclusion, you know, that everybody would be welcome, and that's just something that we would have experienced. For us, balancing the time and the resources to provide the courses, we would love to say we provide these courses all the time, and we do go to great lengths, and it is great getting the additional funding, but our one-to-one sessions are our bread and butter. And some of us work part-time, and that is just something else to be mindful of. So from our years, as I do feel I'm a new person on the block, but there is a well-established service here between Flourish and the Family Centre in Castlebar. This is what has allowed the service to be so successful and effective. It's very well established in the Family Centre in Castlebar. So for us, you know, we have a fantastic staff supervision, care, support, administrative support, the community, it's the base. We're part of a fantastic team of other supports and services available here, and that is really that's really effective. Flourish is an integral part of the support services in County Mayo, so you know, we are non-stop doing presentations to the different voluntary, community, statutory groups, so people are aware that this is a support. It is brilliant to see the increased investment and development of the social prescribing model nationally, as Orla has mentioned, Sláinte Care, you know, that's fantastic. It's really great to see it develop. The interagency collaboration in our communities, we actually couldn't function without that. So that is really important. So we do partnerships, the referral pathways over and back, just good communications, and good connections with our communities. It is great to see the increase in the awareness of the impact of loneliness, and some of the new initiatives to deal with that. You know, I think it's probably one of the positives from COVID that, you know, people really acknowledged how serious loneliness can be, and the initiatives that are there to deal with that. We have one such here in the Mayo County Council Arts Department have just launched their Cultural Companions. So that is an initiative where people can sign up, and they can be involved in a group that would go to different arts and arts events in the county. So when you go and you land at the theatre, you go to your Cultural Companions, and you're there with them for the evening, and you enjoy the evening, because people would often say, I don't have anybody to go, I'd love to do this, but I don't have anybody to go with them. The additional funding opportunities to provide the stepping stone and intermediate groups and programs is invaluable. It is fantastic. It's great for us to be able to provide those. They're very rewarding and worthwhile for the participants and for us as staff as well. And as I mentioned, the Creative Ireland Fund and our Creative Activity in the Community Report launched tomorrow, so that's great. So I'll just go through some case studies. Okay, sorry, and I just am conscious of time now. So if I do need, Fiona, if you need to interrupt, it's fine. But just to say, yeah, so I will just give you an overview of Anne. Anne is a 69-year-old lady living alone in a rural setting. And Anne has had mental health difficulties for about 15 years. And she was referred to Flourish from a mental health service. So she attended our first meeting with her key worker, which was fantastic, because I could see that she was nervous, and it was a big step. And I suppose we took our time to build a relationship and to build trust. And so we would have met here. I would have gone to the centre where she was very comfortable and familiar. So we worked that way. Some of the considerations that I had to take into consideration was transport was a challenge, physical health, rural community with limited services and supports. And so we explored a few things. We looked at Zoom, and I tried to take her step by step through using Zoom as a means of connectivity. We were linked with the HSE service to look for funding for transport, the local link service, our bus service, linking with the community support. And we found a community support initiative that really provided a lot of the activities that Anne was interested in, but the transport was an issue. So for Anne, we did a site visit, and for Anne to do that, she had to get a taxi, she had to get a bus, and then I met her at the train station and we walked to the centre. So just from our plan there, the Zoom was something that it didn't work for her. The HSE didn't have the funding. The local link service, while it was great, it didn't pass her door. And the community support, we did our site visit. I'd been in touch with the worker there, and unfortunately on the day we did the visit, the worker that we had been linked with wasn't available, and we were received by somebody else, and they had very limited skills. I suppose they really they didn't sell the support very well, and it wasn't detrimental or anything, but it wasn't as welcoming as I felt it should have been and Anne felt it should have been. And that was a real pity. And I suppose there was a follow-up for us, myself and Anne, in our work, and also for me as the link worker with the service, just to highlight, the importance of staff training, of staff awareness, that some people may find it more challenging to come into a centre or an activity. And that was well received, and decided that it wasn't for her. And she went on to join a local group in her area, which actually worked out and was very timely, which was really good. But it was learning for me also as a link worker, and I hope for the service that's how it worked out that day. So that was the outcomes, but Anne would say that being involved with, having had the experience, we would have had 7 meetings and a site visit and numerous phone calls, but having been involved in the process, that she would have found that empowered her to take the step to join what was in her local area. And while the site visit wasn't what we expected, having the feedback back to the manager of that centre and everything was positive. I'll just continue briefly with Monica. Monica visited the centre here with her peer support worker, a HSE peer support worker. She was living alone, and she'd been involved with mental health services for about 6 years. But she was very keen, very eager, very interested in a lot of different things. And I suppose her involvement with her peer support worker, so we worked together, the 3 of us, where we obviously, Monica identified what areas she was interested in, what she really enjoyed in life. She was considering rejoining the workforce. And the beauty was that the peer support worker was able to bring her to the different places that she wanted to go. She had no transport. Again, transport was the issue in the rural setting. But she really engaged in the process very well, and joined the leisure activities, as well as engaging with the employability service. So that was great. Paul was a 39-year-old gentleman who again lived in a rural setting with limited family and support network. and had no transport. But he was involved with the men's shed and very active there and received a lot of good support. He was very interested in social farming, and we tried to connect with our local social farming coordinator here in Mayo. Unfortunately for Paul, the social farming didn't materialize because, again, the transport is rural. He was just too rural. The bus links didn't link up. But he did engage with the ETB and begin a part-time course, and that was fantastic for him. So it was like going to the ETB, literally a different bus could bring him to the centre, and it really worked well. So I hope I've given you a flavour of what we do at Flourish. I just briefly, there's two of the quotes from two participants. And thank you very much for your time. Apologies, I went over, Fiona.
No, don't worry. And I didn't interrupt you because it was so valuable just to get those insights. And, you know, a lot of some of the questions that have come up were very much looking at it from the user perspective. So yeah, thank you so much. And what I was really struck by in particular is, you know, in mental health, and what we as mental health reform and our members very much advocate for is that, you know, mental health recovery, that it's not just about the Department of Health and the services that the HSE provide, which are very important and have a key role, but, you know, someone to flourish and to recover, they need, you know, somewhere safe and appropriate to live. They need maybe access to the workforce or access to training, and they also need transport, and they need the resources to be able to pay for that transport. So it's very relevant points that you raised, that there are still huge gaps in how we view maybe a transport service or access to transport. It's not just about getting from A to B. It's actually an essential part of someone's recovery journey or someone's access to support. So yeah, thank you so much. I'm going to ask Orla and Susanna to jump back on. The questions have been coming in thick and fast, as you can see. And just to say, first of all, that the recording of today will be available on the Mental Health Reform website, mentalhealthreform.ie, next week with subtitles, so it will be accessible, and the slides will also be shared. We've had a few questions on that, but yeah, a lot of questions have coming in that I'm going to go through. So maybe for Sarah, and maybe for Orla as well, around social prescribing. I know you mentioned, Sarah, around the online, kind of that online doesn't work for everyone, but can it be accessed online, like phone call or video call, if you can't make it in person? Yeah, so maybe Sarah, if you want to jump in there.
So we have engaged with people online and video. Obviously, again, maybe it's a positive of COVID, and that can be a great starting, you know, and it can that initial phone call, you know, is so important, and then obviously for people who would like to use Zoom or whatever it might be, we would really like, I suppose the ideal is that people are coming out of their homes, and that connectivity and that physical connectivity is so important, and but we are mindful that can be a challenge, and maybe it may take some people longer. Having said that, some people are getting great supports from online support groups. Our music circle that I've mentioned there, you'll say, will you stop talking about it? But you know, we're very proud of it. But our music circle is actually online as well as face-to-face, and it's very, very well received. But the essence is that people are moving out and reconnecting with their community.
Thank you. Orla, is there anything you want to add from the kind of overall kind of perspective across the country?
Yeah, there was a lot of very interesting, relevant questions coming into the Q&A there, Fiona, that I had I'd been kind of feverishly answering, but some of them might be worth kind of exploring in this format, because I'm sure lots of people have questions in relation to some of those that were posed. There was one about waiting lists. Some services do have waiting lists, but for the most part, and Sarah, correct me if I'm wrong from your experience, that a link worker would typically reach out to a participant within a number of weeks really after receiving a referral, usually between 1 to 2 weeks. But Sarah, you might correct me from your experience if I'm right or wrong on that. We're kind of having to be quite careful, I suppose, in terms of our national communication around social prescribing, in terms of going out with bells and whistles, with big PR about it, because we really don't want to create another service with big long waiting lists. So that's why I suppose webinars like this are really, really helpful. And you might see less of us doing kind of the big national media advertising around it, because we just want to make sure that it's a service that people can access in a timely fashion. There was another question in relation to social prescribing for someone in a crisis. And Sarah, again, correct me if I'm wrong, but like typically we would say social prescribing is not a service for somebody who is in a crisis. It's very much about either preventing mental health challenges, or if a person is on their recovery journey from having been through mental health difficulties, or is a family supporter or carer. But this is where social prescribing can have a very, very valuable role, but it is not a service for someone who's in an acute crisis.
Yeah, and that's something that came up in our consultations around the briefing document as well, and maybe something Susanna might talk a little bit more to, you know, in where it sits, because I think, as Sarah said, it is for everyone. But it, you know, even if you're accessing secondary specialized services, you may be in a place in your recovery. Everyone's journey is so unique. It's about where that individual is. But Susanna, do you maybe want to chat a little bit more about that? And also, we got a question in around, you know, maybe from the community and voluntary perspective, you know, what kind of the some of those organizations that people are getting referred into, what are some of those thoughts and perspectives? Because I can see some of them are online now as well and asking questions about that.
Yes, absolutely. Thanks, Fiona. Yeah, the focus groups were incredibly interesting. And I think one of the most prominent theme of the focus groups was that people actually didn't know much about social prescribing. And I think it was even the focus groups themselves are a really valuable kind of sharing opportunity to discuss social prescribing and what it is. There was huge enthusiasm, I think, was the second kind of most prominent thing for social prescribing and how it could link with the voluntary community sector. And I think a lot of people went away with the intention of actually going to contact their local service directly. And I think that's an important message, that, you know, anybody running a service that they think would link well with social prescribing, they can look up the map and find their local service and contact them and say, look, do you know that we have this available? Because obviously there's such a diverse range of issues covered by social prescribing, so it's very difficult for the link workers to know of everything available. So I think I would encourage anybody in the sector to reach out to the local service and to let them know what is available. I think another big theme that came up was the people were spoke about the kind of almost untapped knowledge base of these link workers. You know, often a big issue is people don't know where to go, or where they can access something. And I suppose on that vein, the focus groups, a big theme was the importance of kind of expanding the software and data collection that Orla spoke about. The other thing that came up was about language support. You know, what does somebody do if they don't speak English accessing the service? And I think what I learned speaking to the service I spoke to, that it didn't actually end up being much of a barrier to them, because there's so much technology now that acts as a translation device, and actually people preferred to use Google Translate and not necessarily have an external translator in. They were quite happy speaking over Google Translate, you know, sending messages to each other over WhatsApp and translating it. You know, there wasn't really, it wasn't seen as much of a barrier in practice, especially the service I spoke to. The majority of their participants, it differs from area to area, but the majority of their participants, English wasn't their first language. The other thing that came up was, I suppose, the desire for the cross-sectoral collaboration, and the importance of all different bodies investing in this. So within the briefing document, we speak about recommendations to the government about the aspects you're talking about there, that transport is a huge issue for some rural areas, and that the voluntary community sector need to be adequately supported by government in order to deliver these supports to link in with social prescribing. And we kind of go through and break that down within the briefing paper. And I think you can see from today how flexible and adaptable social prescribing is as a service. And you can see in the case studies that Sarah went through there that she really went above and beyond. And I think that's something that's really valuable. And a lot of the questions I think that came up in the focus group were really well answered today.
Thank you for that, Suzanne. We've some really interesting questions coming through, and there's one in particular. Actually, when we were advertising this coalition, there was a bit of an online discussion actually that happened around the whole wording prescribing, because for those who may not be familiar in mental health, I suppose there for decades there was an over medicalized model of mental health, and as I spoke about, recovery isn't just about the health piece. It's much more psychosocial model approach that we're working towards. But what are your thoughts on terms of prescribing, because it is still grounded in a very medical language, which we're trying to move away from? So Orla, any thoughts?
I get it. I appreciate it. I suppose the challenge, Fiona, is that social prescribing is an international movement now, and the term is recognised. If it was something that we had developed and was homegrown, we probably wouldn't use the word prescribing, because you're right, it's a non-medical intervention and it's very much person-centred, focused on co-production. Some services around the country actually use language like community referral or health and well-being referral, and that's grand. That's grand. It's all the same. But I get it. In fact, you know what? Once people get on board and understand what it actually is, they move on from the distraction of the overarching title. But if we were developing it ourselves and it was homegrown in the morning, we wouldn't have the word prescribing it.
And Sarah, on the ground, what are your thoughts?
Just on that note, we would often be divided, even as team and within discussion, and people would say, oh, social prescribing, why is it so medicalized? But in a way, when you explain it to people, I actually think there's a lot of strength in it, because people think, oh my God, this is something to complement or an alternative to a medical intervention. So I love that it's being developed for green social prescribing, blue social prescribing, this is where it's heading towards. And I just think it's great, because people think it's refreshing. This is my experience now, that some people think it's refreshing. It's like, wow, I never thought that actually could make an impact on how I'm feeling about myself. Getting out into that garden, going there and, seeing that film club or whatever it might be. So that's just what would be my experience.
No, that's really interesting. Another really interesting question that came in that I think is worth discussing is around, I think, Orla, you showed some data around, there is much higher levels of engagement by females rather than males. And there was a comment that came in around, that men who are referred through the service, that there's actually a struggle to engage them in the activities, and that for them to kind of, I suppose, be supported. Is that a trend, Orla, you're seeing kind of across the country?
Yeah, this came up actually yesterday on our advisory group meeting, and our link workers had some fascinating insights. They had said in recent weeks and months, they've noticed a big increase in the number of men joining their service. I'm not sure what that is about. And they referenced a programme that is delivered by health promotion officers in the HSE called Engage. It's delivered across the country, and it's about how to engage with men actually on health and well-being and health-related topics. When I was looking at the data and I saw 37% men, I actually thought, wow, for health and well-being across the board, that's actually really good, because it can be notoriously difficult to engage with men around health promotion and health and well-being related interventions. but I think we've more to do. And I saw Roisin Ryder's comment there, and fascinated by that. And I think there's probably more scope for us to roll out this engage training across the country. But I don't feel like we're doing too badly actually with those statistics. And I'm sure that there's loads of learning there from services, maybe like your own, Sarah, and others, about what worked for them in terms of engaging with men in their communities. I'd love to hear more about that.
Yeah, Sarah, how do you find it in terms of what's the kind of the spread like in your service?
Yeah, it is. As Orla has mentioned, those statistics are about right for us here as well. Definitely more women are inclined to come forward than men, and to engage in our programs. In those stepping stone programs, it can be predominantly the females. I do see a rise in men's. I was at an event last week, Men's Health, just a promotional event, and this man came up and he said, why are you talking to us about health? And I was saying, that's exactly why we're here, because, and then through those conversations, it is really coming to the fore, and bit by bit, it is seeping in that it is as important for our men as it is for our women, for everyone, to take these steps.
Yeah, and it's interesting. Our members that I've been chatting with, more anecdotal evidence at the moment, but have been telling us at Mental Health Reform that there've been more men coming out seeking support from services. Over the last year or two, they're seeing an increase. So I think that's really interesting to note as well. There's we'll take a few more questions. There's loads of really good questions coming in. There's a few I'm going to group together around kind of the future of kind of social prescribing, and some people are kind of looking at that intersectoral collaboration. What really came out of your presentation, Sarah, and a lot of people agreed with that. Programs don't exist in isolation, that you need to provide support for transport, for be it, other types of support that individuals may need. But where can we take this, and how can we get, that cross-sectoral piece strengthened?
Yeah, I might respond to that, Fiona. I suppose social prescribing is truly intersectoral at its core. What's fascinating, because I have a lot of interaction with colleagues north of the border via the All Ireland Social Prescribing Network, is that social prescribing is funded by the Department of Agriculture in the north. So this doesn't have to be all about health. Obviously, I'm here with my health HSC hat on, but it is everybody's business. It's connect. If you look cross-governmentally, the Department of Transport, the Department of, I'll get all the terms wrong, Rural Affairs in the Gaeltacht, social protection, it is cross-cutting. So I'm fascinated by the model in the north, whereby their state funding comes from agriculture, and I see huge potential for the same to happen here. So I think we could have more to do cross-governmentally in terms of getting buy-in and engagement from departments beyond health. To be fair to health, in terms of the Department of Health, they really ran with social prescribing in terms of funding and mainstreaming. But I think there's potential for engagement beyond health. And Creative Ireland are in the Department of Culture, Tourism, Gaeltacht and other things. So they're getting it as well. So they're a key government department that we're engaging with. But yeah, I think there's huge potential. And in terms of the evolution, I see it growing to hospitals. I could see it growing around green prescription, blue prescription in terms of the C, and children and young families. I think the possibilities are endless.
Yeah. Sarah, any thoughts you want to add to that, or?
Well, I think Orla has coined it all. It is, as I mentioned there, just about the social farming. When you look at how effective that is, it does cross all forms. So I don't have anything else to add to that part yet.
Susanna, anything kind of from the work you've been doing that you want to add?
I was just going to say it's really interesting to hear Orla's point about it being funded by the Department of Agriculture, because I think what we are seeing come up over and over again in conversation is about farmers' mental health and about the isolation of farmers. And it is a, you know, a huge issue for the agriculture sector as well. So it's just fascinating to hear the different approach and where, you know, where you could look at expanding in Ireland.
Yeah, and I think, you know, as a membership-based organisation, you know, we really have such a view of all the amazing, and you know, ours is just a small section of the community and voluntary services being provided across the country, and the richness and support that they add to fabrics of communities across this country. You know, while it is very often publicly acknowledged, I think, you know, we also have to say that many of those organizations are also struggling with, you know, the cost of the kind of electricity services all going up, and, you know, funding remaining the same as well. So I don't know if you see that kind of as a barrier to kind of the rollout of this as well, that, you know, it's dependent on those services being available and not having kind of waiting lists and being accessible. You know, if those services are under pressure, is that a challenge that to this kind of model as well?
I think it's a real challenge, Fiona. And as I mentioned from the UK experience, we're seeing that emerge as a real issue. In the health service, what we try and do when we hear about pots of money, be it Healthy Ireland or Creative Ireland, we try to orientate our partners in the community and voluntary sector to apply for those funding pots that can bolster the social prescribing offerings that are happening, are available in communities across the country. And that's what happened with the Creative Ireland Fund. And that's what we're hoping to do with round 4 of the Healthy Ireland Fund as well, is to, you know, there are pots of money out there that can be used to bolster the offerings that are available to support social prescribing. So our role in the HSE is to advocate or to influence, if we can at all, and to encourage our partners in the community and voluntary sector to kind of apply for those pots, so that we can make sure that social prescribing doesn't generate a demand that can't be met by our community and voluntary partners.
Yeah, no, that's great to hear. And, you know, I think, you know, we would like every government department to be investing in these services, be it mental health specific supports or services, or you know, creative arts and sports. There's so much that, you know, we need a cross-sectoral approach on. I'm just looking at the time, and I've taken you a little bit over, but it's been just such a rich discussion. So I just want to again remind everyone, if anything within this webinar was you found distressing, or you needed a little bit of additional support, again, there are the links, and the text load to 580808 will also offer you a text-based support service. So yeah, Orla, Sarah, Susanna, thank you so much for giving up your time and for such kind of well thought out, engaging presentations. As Susanna said, our briefing is available on our website, fresh off the presses. And this webinar is being recorded and will be available on our website with subtitles from next week. For anyone who is interested, you know, in our work, our social media handles are there, and do sign up for Mental Health Reform newsletter to be informed of other upcoming events in the Coalition Conversation series and beyond. A huge big thank you to the team in Mental Health Reform for putting together such a wonderful briefing document, Susanna and her colleagues in our policy and research team, and to Niamh and Stephen and our communications team who work really hard behind the scene on these types of events. Yeah, so let's keep the conversation going. I think it's wonderful to be able to have such a positive, forward-thinking discussion on something that I think we can all get behind, that's really delivering person-centered, cross-stakeholder integrated service. So really looking forward to where this goes from here. So yeah, really, and we will leave it there. So thank you, and Slán.